Before touching the wound, wash your hands thoroughly with soap and water to prevent introducing bacteria or other contaminants. Position the child comfortably, either lying down or sitting in a supported position. Provide comfort and reassurance to help the child relax during the cleaning process. Gently remove any old dressings from the wound. Use a clean, soft cloth or sterile gauze pad soaked in warm water to gently wipe around the wound area, removing any debris or dried blood. If instructed by the healthcare provider, use a mild soap diluted in warm water to clean the wound. Gently pat the area, avoiding scrubbing which can further damage the skin, and then rinse the wound thoroughly with clean water to remove any soap residue. And gently pat the wound and surrounding skin dry with a clean towel. Avoid rubbing as this can irritate the wound. If the doctor provider has prescribed an antiseptic ointment or solution, apply it to the wound as directed. Use a clean applicator or your clean hands to apply a thin layer over the wound area. And now, apply a clean, sterile dressing over the wound to protect it from further contamination. Ensure the dressing is not too tight to allow for proper circulation, and secure the dressing with medical tape or a bandage, and ensuring it stays in place but does not constrict the area. After the wound dressing, dispose of the used dressing, gauze pads, and any other waste in a sealed bag to prevent the spread of bacteria. After cleaning the wound, wash your hands again thoroughly to maintain cleanliness. And keep an eye on the wound for any signs of infections such as increased redness, swelling, and warmth. If any changes occur, report it immediately to the physician.
Good day everyone, so I am Jorge Luis Sanchez and I will be performing an NGT insertion. So first is prepare the equipments to be used in NGT insertion. So first gather the NGT. Let's imagine this, the lubricant, cup of water, dapat cup of water, uh, tape, tape, uh, and a syringe for suction. Explain the procedure, inform the patient about what we will do. So we're going to insert a thin tube through your nose into your stomach to help you with your feeding or draining fluids. You'll need to sit up straight while I gently slide the tube in. You might feel some discomfort or need to swallow. Once it's in, we'll check its placement and make sure it's working properly, and it's more important for your care, and we'll do our best to keep you comfortable throughout the procedure. So, okay, the patient is positioned in upright position with head elevated. Now, next is measure the length needed for insertion. So, from nose to earlobe, then to the xiphoid process. So, we must mark the tube. Mark, mark na natin. So this will be used for securing the tube. Okay. Next is lubricate the tube. Lubricate the tip of the tube. Okay. Next Insert the tube through the nostrils, aiming downward and slightly backward. Gently advance the tube as the patient swallows. So this is for the cup of water. So slowly, slow. So to verify the placement, so by aspirating gastric contents or using pH strips. So the pH is 4, so the placement of the tube is in the stomach. So another procedure to check if the tube is in the proper placement, we must check in the abdominal X-ray. That is the gold standard. So secure the tube. Once the placement is confirmed, secure the tube using with tape. So ito natin. So ganyan. Okay, sir. Now, assess comfort. Ensure the patient is comfortable and not experiencing any distress. And lastly, document the procedure, including the size, length, inserted method of verification, and patient's tolerance. Sir, okay ka lang dyan? Sir.
Good day, I am Heniel B. Machanso and I will be doing a procedure which is insertion of the urinary catheter to a male patient. So you have to gather all the supply before you proceed to the insertion. So first we have here sterile gloves, the catheterization kit. So we also have here, so this is the urinary bag with a catheter. So just imagine this is the catheter and this is the urinary bag. And then this, just imagine this is a lubricant. And then cleaning solution, so antiseptic solution with a cotton swab. So I don't have cotton swab, so this is just a cotton. And then syringe, that is a pre-filled syringe for balloon inflation as per catheter size. So just imagine this is the syringe which has a which is pre-filled. So you have first to wash your hands before proceeding to the insertion of the catheter, and then you have to now position the client. So ensure the patient is lying comfortably on their back with knees slightly bent. So just imagine the knees of the patient is slightly bent and of course apart. And then alternately they can stand with their feet apart and lean against a stable surface, of course apart. So make sure that the patient is comfortable to that position. So this is the surface for the support. Then you have to sterile setup. So open the sterile catheter kit and lay out the contents on sterile field. Put on sterile gloves. So just imagine I put on sterile gloves. And then prepare the catheter. So open the catheter packaging without touching the catheter tip. Apply water-soluble lubricant generously to the tip and the first few inches of the catheter. So just imagine this is the catheter. So we have to the tip of the catheter. So without touching it. So without touching the tip of the catheter, you can apply a water-soluble lubricant generously to the tip and the first few inches of the catheter. So just imagine this is the tip of the catheter. So just imagine there is a lubricant, water-soluble lubricant here. You just have to apply. That's it. Okay, so just imagine that is done. So now we have to proceed to the clean the genital area. So using an antiseptic solution, clean the penis and surrounding area, starting at the urethra meatus and moving outward in a circular motion. Use a new cotton ball or gauze for each stroke and work from the cleanest area towards the dirtiest. So imagine this is the cotton balls with antiseptic solution. So for example, this is the private area of the patient. So you have first you have to hold the penis of the patient on your non-dominant hand, and then in your dominant hand the cotton ball. So first you have to clean the tip in a circular motion like that, and then you have to change with the new cotton balls with antiseptic solution, just like that, in a circular motion. So do this until it's done. So of course you have to clean the scrotum and the thigh area of the patient. Lead to the inserting the catheter. So you have to hold the penis upright with one hand. Imagine this is the penis of the patient. So hold the penis with one hand, with the other hand gently insert the lubricated catheter. So example, this is the lubricated catheter. So just gently insert the lubricated catheter into the urethral opening like that, and then advance the catheter slowly and steadily following the natural curvature of the urethra. If resistance is encountered, pause and gently rotate the catheter. Pause and then gently rotate the catheter until the urine drains freely into the collection bag. And then next, you have to slowly inflate the balloon for indwelling catheters according to the catheter size using prefilled syringe. So example, this is the prefilled syringe. You have to slowly, so example is so slowly inflate the balloon for indwelling catheters according to catheter size using prefilled syringe. So like that. So if the patient experiences pain on balloon inflation, deflate balloon, allow urine to drain, advance catheter slightly and reflate the balloon. And then for securing the catheter, once the catheter is in place, secure it to the patient's thigh, or the abdomen with tape to prevent movement and tension on the urethra. So you can use a tape. You can use a tape, and then you can secure it to the thigh of the patient here, or of course you can secure it in the abdomen part of the patient. So after that, you can dispose all the used supplies properly, and then ensure the patient is comfortable and understands how to manage the catheter and drainage bag, and then document the procedure, including the amount and characteristics of the urine obtained. So that's all. Thank you.